So welcome everybody to this week's broadcast of I Am. We have in mind today that we're going to talk about vaccines, where to get them, how to find them. So this is very participatory as we go through them. I'm sure some of you will have ideas. We'll have some thoughts about what where people can go, what's working and what's not working. We just decided it was time to have an update. This is a broadcast of the Independence Amplified Maryland organization made up of all the 7 centers for independent living in Maryland. It is being recorded, so anything you say can, and Katie likely will, be used against you. So just take a note of that. I am is pleased to bring you this program of importance to people with disabilities throughout the state of Maryland. Um, it will be on YouTube in a couple of days. So if you missed something today or can't find something, we will try and put things in the chat for you. We will also try and make sure we move that material over into the Zoom broadcast so that you can find it there. And it usually gets to Wednesday or Thursday or so. So at this point, you probably most of you have been muted. You can use the chat box, or you can raise your hand if you have questions, or if it just seems like a quiet moment, you can unmute yourself and speak out and tell us what you want to do. At the end of the program today, there will be community announcements. So if you or your organization in the community have something going on and you want people to know about it, please feel free to make that announcement here so that we can get the word out into the community about what's going on in the disability community. Okay, having said that, I'm going to turn it over to Cheryl in just a moment. But I wanted to make a sort of a broad set of observations. Things are still difficult, but they're getting better. Last week, Maryland was averaging 42,000 doses a day into people's arms. When we first started this about 2 months ago, the last show we did, we were doing 10,000 a day. Obviously, I'll do you the math for just a second here. Obviously, if we don't find a way to get well above $42,000, 42,000 shots a day, it's going to take somewhere around 140 days to vaccinate the population of Maryland. That we can't deal with. That 150 days is about 5 months, and really we'd like to target for something a lot more like June or July. So obviously we've got a long way to go, and the process has been a mess. Let's all just acknowledge that going in. Some of it's been a mess because we've never done this before in our society. We've never tried to pull anything off this fast. But also, it's been a mess just because sometimes the people involved have really left us, the folks with disabilities, out of the process for determining who's eligible, and out of the process for making sure that the vaccine clinics, et cetera, are accessible. Um, I want to just say this though, as we sort of come to this broadcast and this my thoughts, and that is this: I want to thank all of you for being there for the last year. I don't know if you appreciated how important you are and how important you've become to me. This basement I live in, or that I sit in all day, it's a lonely little niche. The dog comes down occasionally, but that's about it. But hearing your voices, having you call me, email me, and listen to me occasionally cry with frustration in the last year, I didn't deserve that. I just benefited from you being there, and I just want to thank each and every one of you so much. Thank you for the independent living community, the center directors and the staffs who come together to really make a difference in people's lives, because again, I couldn't do it without you. I would have quit this job a long time ago if it wasn't for you and the love that you have shared with me over the years. And so thank you to the IL community for that. I want to turn this over to Cheryl Grossman now. Cheryl is a longtime advocate, 30-year advocate for people with disabilities. We've been fortunate enough to have her working for the Image Center for the last month or so, helping coordinate vaccinations, helping people find resources, and really helping advocate at the state and the local level so that we can get the kinds of services that we need. So I want to thank Cheryl personally for all that she's done, and she's available pretty much. I don't know when she sleeps, but whenever it is, it's amazing. Cheryl Grossman, you're on.
Thank you, Mike. So Cheryl, a couple notes. If folks have questions, please feel free to put them in the chat or to raise your hand or jump around or something. I am not able to read those myself, so I'm going to rely on folks here to help me with that part. I also just wanted to welcome Chuck into the community. Yeah, all the poor habits that I seem to display here, probably good to stay away from those. It is true, I never sleep. And yeah, and I get myself in a lot of trouble. But if you need anything, feel free to contact me. And that goes for all of you here as well. So I really welcome the opportunity to talk about Maryland's place in vaccine distribution for people with disabilities and chronic health conditions today. Because as we all know, it's been difficult. And let's just start by saying it's been difficult across the country. But one of the things that we need to understand about Maryland is, and the figure I'm about to quote from is a few weeks old already, but as of a few weeks ago, Maryland ranked 42 out of the 50 states and 7 territories in terms of how well we are doing with vaccination distribution and information dissemination to people with disabilities and chronic health conditions. And so that's not a great showing. So as states go, Maryland has a ways to go. And so let's start with why that is. So back in October, each state was asked to provide a state plan on how they would disseminate or distribute a vaccination allotment. So they were asked for how many that was supposed to be based on population. And they were asked for the plan on how they were going to run that. Each state and territory sent in that information. That was back in October. So we didn't have a lot of the picture yet. And so the state plans have changed since then, but every state was basically going off of the blueprint that they put in. Maryland put in a plan, and they said they did it based on, you know, the census data that they had in terms of who was going to be in each priority phase. But that's based on census data. It's based on internal state data that they collect on, for example, people who self-identify as having an intellectual or developmental disability. So we know that countrywide, this is not an accurate number to begin with. But what Maryland did, the state did not feel like they were getting as much response from the federal government as they wanted. And instead of putting all of their resources into trying to change that picture, they turned around to the local counties and they said, each of you 24 counties, including Baltimore City, you're on the ground locally, you know what's best. Go ahead and develop your own plans with your own prioritization and submit plans to us on that. Well, they did that, except for the fact that the plans that were developed were not required to match what the state plan for that same census was. And so there wasn't very much oversight, and there wasn't very much meshing of, did the allocation to each county match with what the original state plan was? So once the state got their vaccination allotment from the federal government, then it was distributed based on the county plans. And so they sort of lost track of who was getting how many vaccinations and who was prioritized in what way. So that's been one piece that has, you know, just blown up the confusion scale because they did not have the infrastructure in place from the very beginning to understand where they were sending what shots. Now, a second system with this, when they turned to each county and said, you all do your own prioritization, you set it up the way that it works for you, is each county then put up their own website with their own prioritization piece. The ARC of Maryland did a survey, I want to say like almost 2 months ago now, and they've updated this scorecard a couple of times. My understanding is that their scorecard is on their website now. I am not able to read it myself, but my understanding is that it is up there and it's updated every so often, and they just did a major update. So what that scorecard does is it ranks or not ranks, that's the wrong word. It shows every county and what their website, how their website is doing in terms of 1, accessibility of the site, and 2, the fairness of the prioritization of people with disabilities. Now, we want to keep in mind that that scorecard looked at those with intellectual and developmental disabilities for the prioritization. It did not look at those on the CDC prioritized list, and I'll go into that a little bit more later. But just sticking with this theme right now, when they did this scorecard, what became very apparent is that each county had put up a website that in some way, shape, or form was inaccessible. Many of them used a pyramid graphic that showed what the phases were for that county. And they took that example from the former federal administration, by the way, which was inaccessible. And all they did was drop that into their website. That graphic is not accessible to many screen readers. So right then and there were a lot of people who could not access what phase the county was looking at, like who was in each phase. And so they couldn't really even determine if they were eligible or not. Many of these websites also had other features of the sites that were inaccessible. And the ARC of Maryland did a decent job of pulling that out and putting that on the scorecard. They approached each of the counties with this, and some have made some changes, some have made progress towards some changes, but there were 6 in particular who did not, and I had meant to look up which of the 6 there were. It was Baltimore City and Carroll County, and I don't remember the other 4 off the top of my head, that were sort of the worst off, and those were subjected to a lawsuit that was filed by the ARC of Maryland and Disability Rights Maryland and a private law firm last week. And we can talk about that a little bit more later. But this sort of came about because, we kept saying, hey, this is inaccessible, you need to change these things. And they're like, yeah, but there was no oversight. Like there was no entity. It wasn't like the state was saying, we're not going to send you the vaccine unless and until you make these website systems accessible. There was no oversight to it. There was no one holding them accountable. And so that has remained, at least for some of the counties. And so when we're talking with consumers, it's really important that we understand this. And I am putting together sort of the cheat sheet based on that scorecard, but the scorecard is probably more accessible to the vast majority of you than it is to me, to just do a really quick look at where each county is at with that right now, because they are updating it every once in a while. So that's a good source of information for that, and we can get that link and we can get that out to everybody who's on the call. So that's one piece. A second piece with each county doing their own thing is because each county was allowed to do a website or a telephone call system or some way of disseminating information, but they didn't have to make it accessible across the board. So very few of the websites that are up right now have a separate phone number that's listed somewhere on the website. Nor is it being disseminated in other ways, like on the radio, on TV, through newspapers. Like, we don't see it on social media. If you call your county health department, or you call 311 or 211, in many of these counties, you're being referred to the Maryland Access Point phone number, which is an information line that was in existence prior to COVID. And it's primarily to give information to seniors, although they do serve people with disabilities as well. What we were finding is that when people would call this number, the regular folks on this information line were having trouble handling the volume of the calls. And so they could take your information, they could send you in a different direction, oftentimes asking if you had family or friends to help you, but they couldn't sit for hours on a website with you trying to help you actually get a slot. And that was proving to be a problem, because what people were actually really needing was the help to manipulate the websites. So it was great that we had information, but that wasn't really solving the problem. And it took probably 4 or 5 weeks to help the administrations at county levels as well as at state level to understand that just giving a phone number was not necessarily connecting people with a vaccination slot. So my thinking at the beginning of this process is they're not getting it. My thinking now, 5, 6, 7 weeks later, is that they are understanding it, but they have not yet, to my understanding, set up a completely separate call center specifically to help folks with disability-specific needs, or needs that the elderly might have in terms of just not understanding technology, not having the technology themselves. So we're not 100% connected yet. I do see a lot of movement in a better direction. And counties are at different places. There are some counties that seem to be doing better than others. And I thought I had seen on here a couple of folks who are using CARES Act funding at other centers. So if they want to jump in and see how it's going, or just let us know how it's going in their areas, that's fine.
Yeah, why don't we pause and see what kind of other county reports we have from other CILs around the state, so we can get a feel for what's going on out there. What are you hearing, folks? Anybody?
So this is Katie. We've been doing, I'm sorry, I've got a crying toddler in the background. We've been doing quite a bit of vaccine advocacy, trying to anyway work. And jeez.
Did you stop pinching that little child?
Sorry.
Hi,
Poor
Katie,
girl.
this is Audrey. Would you like me to?
Yes, that'd be great, Audrey. Thank you.
Okay. Hi, this is Audrey.
Don't start crying, Audrey.
I'll try. It's
All right.
it's just right at the tip of my tongue. I'm the COVID coordinator at Accessible Resources for Independence, the Center for Independent Living, serving Anne Arundel and Howard County residents with disabilities. We've been doing a lot of vaccine equity advocacy with our local county health departments to try to reach out to those folks who are not prioritized according to the county regulations, but are on that CDC priority list. And we have been trying to perhaps set up some formal relationships with our health departments in order to do extend our ability to do outreach into populations that are historically underserved, not only people with disabilities, but people with disabilities who are also people of color, or who don't have English as their first language. So that is some of the stuff we're doing. We're doing some other stuff with our CARES Act funds, but I believe that's the primary stuff that we're doing with vaccine stuff. There is also transportation work that we're doing. So I've been working with Cheryl Grossman, who's the presenter here, and Cheryl Gottlieb on trying to improve physically accessible transportation access to vaccine sites. And I don't know if either Cheryl or Cheryl want to speak more about that.
Cheryl Grossman. I have it on the agenda later on, but if you want to do an intro, go ahead.
So this is Audrey again. Yeah, I'll briefly review that, and then Cheryl Grossman can talk more about it later. The Maryland Transit Administration has mobility service, which I'm sure a bunch of people are familiar with here, also known as paratransit, and that is physically accessible transportation to locations within 3/4 of a mile of fixed route Maryland Transit Administration stops. That's a lot of weird terminology that a lot of people aren't going to be able to really gauge, but basically it's physically accessible transportation within a certain proximity to where the bus lines and the trains usually go. So that does bring up some issues, like what if a vaccine location is outside of that area? How can somebody who needs physically accessible transportation get to a vaccination appointment on really short notice? What about those folks who are eligible for mobility service, but maybe haven't applied because they've never had a reason to in the past? We need to definitely make sure that there are options for folks who need that kind of transportation to get vaccinated like everybody else. So we're working together with MTA to change some of the rules and regulations on a temporary basis.
Great, thank you, Audrey. I noticed that Serena's on here too. Serena, did you want to talk about what's going on in your area for where we're at with the website, accessibility, and telephone number?
Yes, like Cheryl and others have outlined, there's obviously been a bit of a communications issue when it comes to people with disabilities signing up for the vaccine. I know that Montgomery County has recently launched sort of I believe a specialized number to help specifically like visually impaired folks and others who may not be able to use the standard county registration. And we've had some, I think, really receptive meetings, particularly with one of the counties we serve, Montgomery, about possibly more equitable ways to distribute this vaccine, how we partner with organizations maybe near us to create our own hubs. So no firm details, but we're excited about the conversations. And yeah, our counties are struggling with the same issues. Transportation's a big one, and also the lack of cohesiveness between the state tiers and what the county wants and who the county is saying that they are vaccinating at this time. So right now we're just getting people pre-registered and really pushing the county to expand their places to get vaccinated and hopefully get more of our consumers in there.
I would just make the observation that, and I'm going to tell you something that is not on the CDC. If you have a significant visible disability and you're over 18, just go get the damn vaccine. They're not going to turn you away. They haven't turned anybody away at this point. Number two, if your disability started before age 22, you qualify to be vaccinated because you're developmentally disabled. So you qualify on that basis. We've had real hit and miss here in Baltimore City and Baltimore County. Baltimore County has announced that they're going to go to people's homes who can't leave their homes, but we haven't been able to find out just exactly how many people are doing that. They're going to send an EMT and a nurse or something like that. But what we haven't been able to figure out is how many are going out and how many people have been successful. So if you've been successful in having somebody come to your home, please let us know. The other thing is rather more immediate and temporary nature. Baltimore City has put together a clinic for March 24th. If you want to be vaccinated and you live in Baltimore City or Baltimore County, send an email to vaccine@imagemd.org. We'll get you on the list. Yes, and Cheryl just points out that mental illness is excluded, sadly. However, that's and that's unfortunate. The CDC guidelines are in many ways not being implemented by the state when they are. The states really have sort of free run of this. This is what happens when you just throw things out there and let everybody figure it out on their own, is that there isn't a lot of consistency in terms of how these things are being applied. But we need to hear from you by the end of today, which is midnight, I guess. If you want to get on this March 24th vaccine group, vaccine@imagemd.org. If you are a SIL staff, or you would also qualify, by the way. So send us your information. What do we need, Cheryl? We need name, address, phone number, email, and
This is Cheryl.
Yeah.
I was gonna get to this later in the program, but
I
thanks
know,
for
but
jumping in.
I just want to throw it out
That's fine.
early and often.
That's fine. But I believe, Mike, that they need to live or work in Baltimore City or County, correct?
Yeah, Baltimore City or County.
Baltimore City or County, I need your demographics, name, phone number, email, street address. If you, confirmation that you have a disability or a chronic health condition, I don't need to know what it is, just confirmation of that. Confirmation that you're in Baltimore City or County. And if you have any accommodations, let us know. And that's all that the Baltimore City Health Department is asking us for at this point. So yeah, I will circle back around to that at the end of this, just so it's like the last thing in people's heads before we leave. So thanks for bringing that up, Mike. I wanted to circle back around to something that Audrey brought up, and that is, so I talked about the phase 1B. Phase 1B for both the state and many of the counties now, all those who did not get sued, as far as we can tell, includes this intellectual and developmental disability category now. But what is still out there, out in space, is this CDC prioritized listing. And this, the CDC, the Centers for Disease Control, came up with this list not as an exhaustive list. They came up with this because there was enough data from enough people being sick and dying from COVID over the last few months that there were doctors who specialized in these conditions that were noticing patterns amongst their patients and wrote scientific medical papers about it, saying, hey, folks with these underlying conditions are getting sicker and dying more often. And we need to have this in the medical literature because this is a novel virus. And the CDC took that information and said, hey, we don't know a whole lot, but this is what we do know. And by the way, this isn't meant to be an exhaustive list because we're studying people all the time. It's just, here's a starting point. We know that people who have respiratory conditions are doing worse. We know people who are who have a higher body weight tend to do worse. We know that people with diabetes tend to do worse. We don't exactly understand why, but we're gonna pick these specific diagnoses and we're gonna at least start a list with that. Well, the problem when Maryland went to each county doing their own thing is that the CDC list was not in final form at that point when that happened. So what ended up happening is the state of Maryland eventually created this phase 1C that included some of the conditions on the federal CDC list, not all of them. There were only 6 that were put on there. And I'm not sure why those particular 6, but that's what got on there. But because that came later on, after the counties had already started their own thing, there was no oversight, there was no guidance to each of the counties to say, hey, by the way, we as a state moved people with these CDC conditions into what we call this phase 1C. So some counties went ahead and created a phase 1C and put folks with CDC conditions in that phase, and other counties never created a phase 1C. And so what ended up happening with that is phase 2 is something different. Phase 2 is those who have comorbidities that may put them at higher risk But that doesn't necessarily overlap with every single person who has that CDC listed condition. And so there will be some who qualify in phase 2, which puts them lower down. And then there are some who get missed altogether because this phase 2 didn't really address those specific needs, and where the county didn't create a separate category for them. So we have raised this issue at both the county and the state level. It was not included in the lawsuit that just went in, but it is known to all the parties, and we continue to do that advocacy to help folks understand that there is this group that the CDC has identified by scientific research is at higher risk and should be elevated and offered this vaccine higher than someone who does not have as much of a risk of death from COVID-19. So that's some of the work that we are still doing, and it's creating confusion. And I want to actually correct something from you, Mike. When we say that folks haven't been turned away, that's not exactly true. We are beginning to hear stories where, let me back up. This is a messaging issue. The state and each county is not doing a fantastic job of saying, this is the phase that we are in. These are the people who are eligible in this phase. What we are messaging is sign up on every list that you can possibly get on. And what happens when people do that is people don't realize when they're signing up on a website or calling a number, are they registering for something that is controlled by the state, which there are 6 mass sites that are controlled by the state, and or am I signing up with a county or the city, Baltimore City? So the state may be in a different phase than where the county is. And if you think that you have a CDC prioritized condition and that's why you are trying to register, and you sign up for the state site that is open to phase 1C, and you can get an appointment, that's not probably going to cause you any problems. But if you happen to get into a slot in a county that has not been opened to that or does not have a phase 1C yet, and you show up, you can be turned away. We are pushing for that not to happen. That was part of the reason for the lawsuit under the phase 1B, the developmental disabilities, where we have seen people with developmental disabilities who got a slot, went for their first dose. They showed up to a particular location that was only open to seniors still. They were still only in phase 1A, and this person had signed up and gotten a slot for phase 1B, and they're like, we're not there yet. And so they turned the person away. If they had gone to a state site that was already open to phase 1B at that time, they would have been able to get that shot. And so that is part of the problem. We are beginning to hear folks being turned away. So if you run across a consumer that has had that issue, please, please, please let us know. And the ARC of Maryland, if it's a person with a developmental disability, the ARC of Maryland is interested in having that information as part of the lawsuit. If you're not under that, Disability Rights Maryland is also interested in those stories.
Cheryl?
Yes.
This is Katie. There is a question in the chat. Did you want me to interrupt you to get it in there? Okay.
Go ahead.
So they said, as for accessibility at the vaccination site, are there county, state, federal guidelines such as priority in line or separate areas for adults and children with IDD?
So this is Cheryl. That's a really great question. The question is going to be the same as what Centers for Independent Living always say, and that is that during a pandemic, the civil rights laws for people with disabilities do not magically disappear. So these vaccination sites are subject to the Americans with Disabilities Act and Section 504 of the Rehab Act if it's a federal site. That being said, the local, whoever is running the site controls which law is going to apply for that site. So if it's a federal site, if it's one of the FEMA federal sites, I believe there is one going to be in Maryland that isn't quite up yet. Section 504 of the Rehab Act is going to apply to that. If you're using a Veterans Administration facility that gets federal funds, that will be under that. If you're going to a state mass site, that will be, the Maryland state laws will apply for that. If you're going to a county site, your local laws will apply to that as well. If you're having trouble with it, if you notice that there is not the accessibility that you need, again, we need you to be reporting that, because that's the only way it's going to get fixed, because we're not seeing the oversight of each one of these sites. Now, something that we haven't talked about are the private retailers, and that's a whole different ballgame because they're private entities. They're still subject to the same Americans with Disabilities Act rules and regulations. But each one of those has a contract on their own, which is much harder to get systemic change. It's like each single site. So that's proving a little bit more difficult. It's not to say that we don't need you to report it. We do need that information. It just might be a little bit harder to make the change quickly.
I need to correct something that
real quick.
Go ahead.
I just wanted to add that a lot of the sites have things like wheelchairs on hand for people who can't walk very far, or ones that are drive-through are really not advertised as drive-through. My point is that the accessibility stuff a lot of times is there, but nobody is advertising the fact that these accessibility features are available, and you don't find out till you show up. So it would be helpful for the whole group if you go somewhere, wherever it is that you end up for your shot, if you find those things there, if you could bring it back to the group so that we know, so that when our friends and family go, like for example, my mom went to Waldorf. She has a broken foot in a non-weight bearing cast. Didn't know till she showed up that it was a drive-through. So she rented a wheelchair that she didn't need to rent. So if people could just kind of pass this stuff back through so we could disseminate it, it would be helpful.
Yeah, and this is Cheryl. I just want to add on to that these sites are changing every week. So like in between my two shots, for example, the site that I went to was a state-run site. They had some accessibility problems the first time. I reported those. I know that others did. By the time I went back for the second shot, they had completely redone the entire site, and it was absolutely a horrid mess the second time I went. So these are changing very frequently, and I think that's part of the difficulty with the messaging. But I definitely think that we need a unified voice pushing forward to the state and to the counties to keep one consistent thing and to message that.
Hey, Cheryl.
I know Lauren Young is on, and I'm wondering if she has any comments. And then I need to correct, first of all, some information I gave out on the chat box a few minutes ago. Children, the only vaccine approved for children under 18 is Pfizer, and that's 16. Nobody under 16 is approved for any of the other three. The Moderna and Johnson & Johnson vaccines are 18 and older, and Pfizer is 16 and older, just to make sure we clarify that. Lauren, I don't know if you had any observations or comments or updates you have from Disability Rights Maryland. Anything you'd like to comment on?
Thanks, Mike.
Sure.
Greetings to everyone. Thank you all for your interest in advocacy. I'm sorry to be late on the call. I don't know if, Mike, you want an update from our case or wanted me to comment on the accessibility issues for sites. I think.
Yeah, either or both. You know what? Anything you say is helpful. You guys are amazing.
No, thank you. But some things we didn't understand, which Cheryl and others have pointed out to us, would be a different case. But so the jurisdictions that we sued are pretty much complying with what our request was for them, which was that they had to change the information on their county websites and that linked to health department websites to identify that people with IDD are in fact eligible under phase 1B of the vaccine. Interest forms were created for that population, and almost all the counties are in city. Maybe one hasn't yet. They're not offering any interest lists. They've noted that their information is updated. They put a contact information online for folks to call if they have IDD and need somebody to talk to or help getting registered. And they've instructed staff that this group is in fact eligible. So
Hey,
those
Lauren,
Yeah.
I'm sorry. Hi, this is Katie Collins-Erkey. Hi. I was wondering if you could tell us again what counties those are, or counties are. I think Baltimore City was one of them.
Baltimore City, Talbot, Carroll, Somerset, Queen Anne's. What did I forget? I have to look up. I think I forgot one. There were 6, so I must have forgotten one. Garrett.
So
Say
Cheryl
Garrett.
listed out after.
So, but I think Cheryl was pointing out, and she's correct, that some of these counties, and one that I had just spoken to, because Cheryl made me aware of it, also don't list some of the others' conditions, right? Although the state's only identified 6, and it's fairly limited still, right? Because you have to be served by a hospital, inpatient or outpatient, but those conditions, those lists of 6 conditions are not on the state's graphics and information. So a lot of the counties have also left them off, and at least with one county I was just working with, thanks for that heads up, Cheryl, they are now included. That county I don't think is in 1C yet, but at least they're listening on little baby steps, right? I just wanted to say very briefly, in terms of accessibility, the state sites are covered by 504. They should be covered by 504 as well as the ADA, because the state, it's federal funds, and you can those obligations about accessibility continue for direct service from a state or locality, or if it's under contract. So they do have those obligations under 504 as well as ADA.
Hey, Lauren, it's Sarah Basehart. We wanted to follow up on, the SIL directors were meeting with some state folks about, the possibility of other groups of people with disabilities that don't qualify under the definition of IDD, being raised at least into category 2, because otherwise there's a lot of folks that aren't going to be eligible if things remain the way they are now until 3. So I think, Katie, you might have the name of that letter or remember, but we had written a letter. I think, well, we all signed on, and it was
Right.
about sort of upgrading other groups of people with disabilities who have underlying health conditions and other things. And we want to reissue that letter if it's possible, because there was some possibility of, could we get it into category 2?
Totally agree. Totally agree. Or at least, I don't know that we want to settle for 2, but at least push it, right? Yeah.
Of course. Thank you.
Yeah. I think there is a person at our office who is trying to do that, working on that. I'm not saying wait for us if you would like to do that, but I think that was coming from somebody's discussion. That was my understanding.
Great. Thank you.
Agreed. And it should be circulated to the same large groups.
Well, I think one of the keys too is people who can't social distance because they're either in a wheelchair that needs to be pushed, or maybe they're blind and they have to take somebody's arm, and so they can't social distance. I mean, all these things are critical, and these guidelines just don't work for that.
Yeah, absolutely true. We have DOD's folks on the call. I don't know if they can chime in.
Well, that's who we were meeting with. So we were working on it.
I just didn't know if there were any updates.
So this is Bong, and this is really directed to Lauren. So Lauren, based upon the discussion that you and I had last week regarding this, in your case, I did put in a request to update the health department, the Maryland Health Department website to include the IDD in it, in their phases. So that should be updated hopefully this week.
Yeah, that would be great. And then we have to work
Yeah.
on 1C.
Yeah,
We're not in
that's
there
nice.
either. Yep.
Right.
Thanks, Bong. We
You're welcome.
appreciate it.
No
I've
problem.
gotten a couple of calls actually this morning about that. So apparently, if you call the number for a state site, they are giving information about eligibility under the phase 1C, but the website itself doesn't have the questions on it still. So yeah, that would be helpful. Thank you.
Yeah, not only does it not have questions on it, it doesn't identify people in 1C.
Right. It doesn't identify it.
Yeah.
So.
Yeah, that should be a fast fix. And since so many of the counties are using the state information, they link to it. It really has caused these problems.
It has. Thank you. And just as a plug for Lauren, we can all hear more about the lawsuit and how it's going this coming Wednesday when she joins us for our self-advocacy group meeting starting at 7:30 p.m. It'll be a Zoom meeting. And if you are not on that email list and wish to be, if someone can drop my email sgrossman@imagemd.org into the chat box, just shoot me an email or shoot your director an email and they'll get to me and we'll get you the link for that. And Lauren's gonna help us understand the lawsuit a little bit more. So thank you, Lauren, for that. I see a bunch of flashing on my screen. I'm gonna guess that there are comments or questions in the chat that I can't read. Can someone help with that?
Yeah, so some of them had kind of been answered by other people, but here's one. Should we expect the same amount of confusion about and between state versus county and national groupings for vaccinations?
This is Cheryl. I want to idealistically say that this is going to get better. I think we have some indication that it's going in the right direction, but keep in mind that each of these are systems and they move slowly. So we will keep chipping away at this, but be a little bit patient, be a little bit flexible. If you run into problems, please do let us know so that we can keep on top of it, along with you, so you don't have to do this alone. But yeah, just please try to be a little bit patient, a little bit flexible. Hopefully things will improve soon.
I would say this, if you want a vaccine, now is the time to go get one, because if it turns out that nationally, May 1st, everyone becomes eligible, note I didn't say that they were going to get a vaccine, they just become eligible to get one. The floodgates are going to open on May 1st, potentially. And so you want to,
Yep.
I know it's frustrating right now, but the frustration level could go way up if you wait until May 1st.
That is true. That is true. Okay. Are there any other questions or should I?
Hey, Cheryl, this is Heather. Let me look through and see. So you answered that question. Somebody commented there needs to be a requirement that phone operators ask callers if they need accommodations.
Yes, agreed.
Is someone able to tell which vaccine is provided when setting up an appointment at a clinic, for example, Pfizer versus Johnson & Johnson?
So this is Cheryl. That's a really good question. And the answer is that it depends. We've been asking the same questions. And it seems like the state sites and the county sites, they know about a week in advance. They know when they get their shipment for that week, what that shipment is. But it's not always the same. It changes, and sometimes they don't get their shipments. If you're going with a private retail entity that is only contracted to get a specific product, they're putting that, for the most part, they are putting that on their websites. My understanding is that a lot of those websites are harder to manipulate, are harder to read, but you're talking to somebody who doesn't use them at all. So there might be somebody else who can say, hey, I've seen it for this particular retailer that they're only doing this product. And if we get that information, we can certainly put that out to our network as well. Hoping that answered that question.
Stacy from Southern Maryland responded that she was able to schedule her appointment for a day and a time for a specific vaccine maker and was able to pick between the three.
Excellent. Love it. I wish that was everywhere. Okay. Are there any other questions before I move on?
So we had a question. I thought that if you were 1C, you had to get the vaccine by the hospital giving you treatment or at one of the 6 mass vaccination sites only. Can you go anywhere?
So this is Cheryl. Again, you have to go where you could actually sign up to get it. And this is what we've been pushing for, is like the private retailers, for example, are not necessarily following that. The hospital systems have their own ratings, and they're doing their own separate thing. Like Hopkins, for example, has a lottery that they have behind the scenes put all of their active patients into, and they're pulling about 20% from that list every time they get a vaccine allotment. But that's behind the scenes, and then you are contacted based on that. But you have to have a patient portal in order to do that. So any of us who don't have good access to internet or cannot read the patient portal, your names are not necessarily in there. So I've been telling folks, contact your doctors, figure out what their system is, see if you're going to need assistance with that to see if their office can help you out to do that. In many cases, I've had people call about that, and they've contacted me back saying that was very helpful. So hopefully that will be for you all. Okay, any other?
Yep. There's one really fantastic question. I don't know I've got feedback from somebody here. Christina asked if we know what the legitimate email addresses are that send out registration information for vaccines. She said she received an email that she suspected was a scam.
That's a very good question, and I'm going to throw that probably to Mike Bullis, who's been dealing with the security of emails much better than I am.
There are some scam emails out there. The only that are going out, people are being charged for, vaccinations that of course don't exist. There's all kinds of problems. So if it's not from someone that you have contacted, that is, I signed up with MedStar, and then probably 2 weeks ago, MedStar sent me an announcement saying, hey, your time is here. You can now get on the list so we can schedule your vaccination. By then I didn't need it. So I wrote back to them and said, no, thanks, I'm good. And they said, thank you. And that was the end of that. But I knew that MedStar was going to reach out to me. But if it's just a random contact that somebody's making with you, there's a good possibility it is a scam.
Right. And this is Bong, and I just want to add to that. So it's, when you sign up for your vaccination, through the registration process, once you sign up, you should automatically, almost instantaneously, get a confirmation email once you do that. So when you do that, just take note of the email address that you're getting it from. So that way, when your time does come, or a week later, when they do try to get in touch with you, you kind of know that it's coming from the right place and it's not coming from a scammer. So I would definitely just make note of the email address when you initially sign up, through the process.
So this is Cheryl. I just want to point out that there are lots of folks who are not making their own registration appointments. So this is much harder. Especially when we've been told to sign up at every and any site that's possible. I will tell you, I had people from all over the country literally helping me to sign up, and I had no idea what were legitimate ones and what weren't. So I just want to point this out to people. It's great if you have a network to help you, but if they can help keep track of those email addresses that it could be coming from, to please help with that, because that it is a risk to do it that way. And we do know that, like, we're weighing different risks against each other here. So yeah, just kind of keep track of that. Text messaging in the same way. Also, in terms of the confirmation emails, we are seeing that some counties are getting backlogged. So it may take a week or more to get a confirmation email. So hoping that is getting better as we move forward during this process. But many people have been saying, hey, I never got a confirmation email. And then 2 weeks later, it showed up in their inbox.
Yeah, it's a crazy process right now still.
Okay, this is Cheryl. I want to just make sure we have time for a couple of things. Audrey did a great update on some of the transportation issues that have come up. So I want to hit that, and I also want to hit what happens when somebody doesn't have any other mode of transportation and needs the vaccine to come to them. So in terms of transportation, it's for Centers for Independent Living folk, it's going to be helpful to know what the state and county is contracting for locally in terms of getting to vaccination appointments. So for example, in Baltimore County, the county has actually contracted with Uber to reimburse for rides to vaccination sites. The difficulty with that being there are no physically accessible Ubers that are listed on their list of Ubers in the county. So if you need a physically accessible vehicle and the county is not reimbursing for that, make sure that you're keeping track of that. And if there's an opportunity to do some advocacy around that, that would be helpful. In Baltimore City County area that MTA does cover with mobility, that's actually what sparked our discussion with MTA. And while we're not 100% there yet, we have had some productive conversations about how paratransit could potentially be used to help us in filling in those gaps. So have folks around the state had other discussions like this or entered into partnerships like this? If you want to take the reins here.
So this is Bong. The answer is yes. And actually, I have a meeting tomorrow with Lyft. And I know it doesn't really address the physical transportation side, especially for those who are in wheelchairs. But we are also looking into other things. I know one of my counterparts had a meeting with the SIL directors, I think last week or the week before, in regards to some transportation questions. But we are looking into other transportation efforts, some using Medicare and Medicaid transportation, trying to figure out how the billing would get done, especially if it was through a MaxVac site, which is not necessarily billed there. So we're hoping, to get some good news this week. We're very hopeful, and like I said, tomorrow I have a meeting with Lyft. So hopefully we can get things going. But I have seen a trend in certain counties. For example, Allegheny County is using the Medicare program, the NEMP program, to get people with disabilities and the vulnerable population to their appointments, which is absolutely great. And then again, here in Baltimore County and Baltimore City and Anne Arundel County, yes, we do have mobility. We're trying to, outsource that. So the state is also in talks with MTA as well for a larger scale, for transportation.
And
This is Sarah.
oh,
Can I just add something, Cheryl? So in Montgomery and Prince George's, and hopefully, Bong, those conversations will continue down to WMATA because we don't all use MTA.
Yes.
And we're, working on a clinic potentially at our office, getting closer to that idea. And we're planning to have our own conversation because we have relationships with WMATA, and ours is Metro Access is the paratransit system, and hope to call in some favors there, and that they'll consider it to be a good, goodwill effort to get folks to vaccines. Uber and Lyft are both offering all the time, the free, although we know it doesn't work. Although we do have some Ubers in our area that are accessible for folks that use wheelchairs, but it's not as consistently possible. We may use some of our CARES Act funds to pay for wheelchair accessible transportation if we're hosting the clinic, so that it can be available right there. Serena, what are the other? So a lot of transportation, ideas that we've gone around and around, but we're working with another community organization to try to put it together to be on site at our office. So.
Mhm.
I know that some people leave around 3 or after, and I've seen a couple of community sort of announcements. If there are people who want to make community announcements, why don't we give them a second to do that, and then come back for any final questions or comments or thoughts from Cheryl and anyone else who needs to. Are there folks out there that want to make community announcements?
I want to make an announcement.
Fire away.
All right, so I don't know that anybody's announced that we have started a book club. It meets every Tuesday from 4 to 5. We just finished Judy Human's book, and we are starting a new book. It's called this. Oh my gosh. I hope I can say this. I'm not good with putting same words that have the same syllables together, but it's called Disability Visibility by Alice Wong. We've just started that book. So if you're interested, you can go to the Freedom Center website and register there. You'll get the link and you can start participating. What we do is we listen to the book, we discuss the chapters, and then we talk about how the book affects us and what we can do as advocates to make things better. All righty?
Cool. Thank you very much. Anyone else with community announcements?
Yes, it's Sarah again, Independence
Hey.
Now. We have a fundraiser this weekend, a virtual trivia game. I just dropped the Eventbrite link in the chat. If you haven't seen it on our Facebook page, you're not paying attention. It's been everywhere in our emails and our Facebook, so it should be fun this Sunday evening, 6 to 7:30 or something like that. And it's this Sunday evening. Click and buy a ticket, support Independence Now.
Thank you very much. And if you have a few coins to do something with, please support Independence Now. But also remember the IM broadcast. These things can't happen without you. And we thank you so much. When you get that confirmation back, it'll have an opportunity for you to donate. Every dollar really does help. Thank you so much. Anyone else with community announcements?
Hey guys, Stacy Tobin at Southern Maryland Center for Independent Living. Our AT Loan Library is hosting a 30-minute training on Wednesday, March 24th at 1 o'clock, a closer look at magnifiers. I put the information and the registration in the chat.
Excellent.
So everybody is welcome. We're just going to talk about magnifiers and part of our AT library.
And you're hosting helping to host next week's session.
I am.
You want to
Sounds
announce
like I'm doing it by myself, but we will be talking about our Maryland loan libraries and community lending libraries next Monday.
Cool. We've got one too, so we'll be part of that as well. Thank you guys. Yeah.
So this is Katie. I did put some links in the chat for our events, and I was too quick and I pressed enter and I didn't mean to. So there's some old events there. Those have already happened. So don't go to those, but there's some events coming up that you might be interested in participating with.
Oh, fine.
I also really quick wanted just to mention when we were talking about transportation and things, Howard County has actually has a mobile clinic. One of our former board members got vaccinated that way. They came to his home. He didn't have to leave and they vaccinated him right then and there. So that's really been helpful. And Anne Arundel County has been very, I think, prepared, and from the Office of Transportation standpoint, they have taxis and they're also using their ADA paratransit that the county has to transport people to vaccine appointments. But I believe they have to stay in county, so that limits your options.
Yeah.
And Katie, hasn't the Howard County health department teamed up with the fire departments as well?
I
'Cause-
haven't heard that, but you know,
Because a friend of mine who lives in Howard County said that he was able to get his shot.
yes, I think that's who does it.
Okay, okay.
Yeah, they're like,
The fire departments.
Oh,
Okay.
I thought it
Yeah.
was maybe if you like spontaneously combusted or something, they would
stop.
put you out.
They plan on doing it in Baltimore County as well, but they haven't figured out quite how to do it yet. So that's sort of in the works for Baltimore County.
Yeah.
I have heard the same for Southern Maryland, but I haven't gotten any confirmation on it yet.
Okay, Cheryl Grossman, thank you very much. Have you got more for us today, or are we good? Anything we've forgotten?
I was just going to mention for those who are homebound, your counties are starting to look at how they do this now that the Johnson & Johnson product is available. It's making it easier for folks to stand up mobile clinics. So I'm encouraging continued advocacy around this because there will be some people for whom we just can't get to a site. And my fear is that as we open these up, just like Mike said, everybody else is just going to rush in and it's our same most vulnerable folks who are going to be stuck again. So I think that's a good focus for our advocacy going forward. I'm going to leave it to Mike to send out the announcement about the Baltimore City Clinic again. Again, this is for Baltimore County and city residents. I do need to have this as soon as possible, and my phone's been ringing off the hook during this entire session. So I have a lot coming in, but keep them coming, please. Let's just fill them up. If we get enough people, they might have to open up a second day for us. You know, gosh forbid, we should actually get our folks vaccinated. So let's do it.
This is Heather. Cheryl, I posted it. This is Heather. I posted it in the chat box. Crosby
Excellent.
asked for it. So I went ahead and posted the same thing that we emailed out today.
Yeah,
Excellent.
we sent out another email blast this morning, so
Great.
we'll see what happens. Yep.
Okay, and then last announcement is a plug for the self-advocacy group meeting Wednesday, 7:30 p.m. Folks, contact me, sgrossman @imagemd.org if you want to get on that email list, and I will send you the link to it. Thank you so
Hey,
much.
and one final pitch. If you're following the news carefully and you have somehow concluded that the Johnson & Johnson vaccine isn't as good as the Pfizer ones, you have to read those studies very carefully. I can tell you this, your odds of getting the virus after you take either vaccine and getting sick are about the same. So please don't needlessly engage in vaccine hunting, because unless you have a medical condition that requires you to have one or the other, these are all good vaccines, folks. All three of them are excellent vaccines, and they will protect you from ending up in the hospital or getting sick significantly. So get out there, get something in your arm that works for you so that we can all get protected and go out and do things again and be a part of a community. I can't wait to hug you all. I missed you so much.
Doctor
Anything
said
else?
to Serena and I last week that Johnson & Johnson, even if it's 75% effective, we would have passed it in an emergency situation like this if it was 50% effective.
That's right.
And that every year, many of us get flu shots that are only 50 to 60% effective. So please remember all of those things when you're worried about something being better than another or a creme de la creme vaccine.
So this is Cheryl. That's an excellent point, and one that I do want to stress when we're talking to consumers about, because I've actually had people turn down this vaccination clinic because we can't tell them which product we're going to get, and they're scared it might end up being the J&J product. So we need to be messaging the same thing all the time, is that your risk of getting COVID and dying from it is high, and it's probably a much more acute issue than any side effects that you might have from a vaccine, which so many people have now gotten, and there's just no evidence that there's a problem with it. So we need to just be saying, hey, this is your opportunity, don't pass it up. What if you get sick? This is the message that we need to be sending out there. And we are seeing that. And we're also seeing reticence I'm seeing reticence. Well, gee, there's not scientific evidence on how it's going to affect me with an autoimmune condition or an immune compromised condition. And that is true. We do not, but we don't have that data on other vaccines either. And the reason why is when they do clinical trials, they want to get good data and they want to get that data quickly so that they can make money on their product. Those of us with disabilities are traditionally not included in these things. We are working on that as a systemic issue, as always. But it shouldn't, if it doesn't, deter us for other things, it shouldn't deter us for this either.
As I said to the lady at the vaccine clinic with tears streaming down my face, you have got to have the most wonderful job in the pandemic, giving people a vaccine that gives us so much freedom and so much hope, folks. So get the vaccine, take it. The nice thing about Johnson & Johnson is you only have to go find it one time and go get it. So, and you're good. So anyway, I want to thank everybody for listening this week. If you have an opportunity to be here, make sure you get on our list. It's every Monday at 2:00 from 2 to 3:30. This is I Am Independence Amplified Maryland. Thank you to everyone who participated today. And we will see you next Monday with what showed it next Monday? Oh, about AT loan centers around the state. So see y'all next week.